Hello, I'm Bob Van Howe, the Medical Director of the Western Upper Peninsula Health Department, the Dickinson Iron District Health Department, the Marquette County Health Department, and Public Health Delta Menominee Counties, and I'm here to talk to you about measles. I realize my title may be a bit extreme, but it's just a matter of time. We've seen a number of recent measles outbreaks across the country and in downstate Michigan. We had 2 cases last year in Marquette County. The MMR vaccination rate is currently falling. People susceptible to measles have visited countries where measles is endemic or visited parts of the United States where epidemics are ongoing and brought measles home with them. Measles is extremely contagious. Each case of measles can infect up to 12 to 18 people. If 10 susceptible individuals come into contact with someone who is contagious, 9 will become infected. Because measles is so extremely contagious, a vaccination rate of 95% or higher is needed to provide herd immunity. The cost of a measles outbreak, which would include the cost of outpatient visits, hospitalizations, medications, families' lost time from work, containment efforts, contact tracing and testing, and the quarantining of contacts, adds up to $20,000 to $50,000 per case of measles. Houghton County is currently at extremely high risk because our vaccination rate for measles for children is between 66% and 77%, well below the 95% needed for herd immunity. The 18% rate of school vaccination waivers is the highest in the state of Michigan. When we have a measles outbreak in Houghton County, we anticipate between 200 and 300 cases in a 2 to 3 week period. This would involve 40 to 60 hospitalizations, which would overwhelm our local hospital capacity and our ability to transport patients to other facilities. So, as a clinician, what can you do? Begin by identifying cases. Keep in mind that a patient with measles will be contagious for 4 days before the rash appears, so others may have been exposed without knowing it. The presence of a cough, runny nose, conjunctivitis, and a high fever between 102 and 104 degrees Fahrenheit are red flags as they can present for 4 days before the rash breaks out. The erythematous macular papular rash begins on the forehead and spreads down the body. This patient has a classic measles rash. The diagnosis of measles is based on clinical presentation, exposure history, and laboratory tests. Early in the outbreak and when the diagnosis is uncertain, testing is essential. To minimize generating false positive results, testing should be limited to those who meet the clinical criteria. Some of the materials needed to conduct measles testing has been in short supply recently, so you may need to determine which laboratories can perform the test in a timely fashion. The good news is that measles PCR testing is now available in the Upper Peninsula. Timing is a major determinant in deciding which test is chosen. When possible, collect both serum and swabs. Collect, store, and ship the specimens properly. This graph shows the testing windows for the measles diagnostics. The period of 3 or 4 days of fever is followed by 4 days of rash, followed by the recovery phase. The swab for PCR testing needs to be obtained a day before to 4 days after the rash erupts. Ideally, blood samples to test measles IgM will be collected 3 to 10 days after the rash shows up. Measles antibodies will confirm the diagnosis, but if the sample is drawn too early or too late, the levels may be artificially low. There also may be cross-reactivity with other febrile rashes, such as parvovirus, roseola, enterovirus, and adenovirus. False positives are more likely when the preset probability is low, such as when there is no active local transmission, no history of travel, no known exposure, and the person is fully vaccinated. Finally, if indicated, you can draw acute and convalescent IgG titers, with which a 4-fold titer rise would confirm the diagnosis. Detection of the measles virus is available through PCR testing performed on samples from the nasopharynx, the oropharynx, the throat, or urine. The window is fairly tight for detecting the virus, so collect the specimen in the first 4 days after the rash appears. Pay close attention to collection, storage, and processing. PCR testing has a higher sensitivity and specificity than serology. The test can be performed, usually the same or next day, at the laboratory at the Western Upper Peninsula Health Department. Alternatively, the Michigan Bureau of Laboratories or a commercial lab can test the samples, but this may delay obtaining results. Because the vaccine can produce mild measles symptoms for 21 days following the injection, a measles vaccine-specific PCR is available for those who've been vaccinated in the past 21 days to distinguish between the vaccine virus and the wild virus. This test is performed at the Wisconsin State Lab and requires prior approval. This slide presents the measles testing algorithm for those people who are into this stuff. As I mentioned, measles PCR testing is now available at the Western Upper Peninsula Regional Public Health Laboratory. All that is needed is a physician order and insurance information. No prior approval from epidemiology is needed. Requisition forms are available at wuphd.org. The laboratory operates Monday through Friday from 8 a.m. to 4 p.m. Saturday measles testing may be available by request of your local health department. Guidelines for sample collection are available online through the Michigan Bureau of Laboratories. A swab for the PCR can come from the throat, oropharynx, or the nasopharynx. The swab needs to have a Dacron tip with an aluminum or plastic shaft. A swab with calcium alginate or cotton tips with wooden shafts will be rejected. Do not allow the swab to dry out. Break off the tip in a container with 2 to 3 milliliters of viral transport medium or universal transport medium. The specimens need to be refrigerated for the first 72 hours. If it's going to be kept longer, it needs to be frozen. A urine sample of at least 50 milliliters needs to be refrigerated immediately and cannot be frozen. Measles IgM and IgG levels are tested using serum, not plasma. The quantity of the serum is at least 2 milliliters. Blood should be collected in a red top or serum-separated tube. The blood needs to be centrifuged following standard protocol. The sample needs to be refrigerated within 8 hours of collection. Do not store at room temperature. If the sample will be stored for more than 48 hours, it needs to be frozen. At this point, send both swabs and serum to the Western Upper Peninsula Lab, and the lab will determine where to send the serum. Regarding the paperwork, if testing is to be performed at the Western UP Lab, all that is needed is an ordering physician, patient insurance information, and a completed Western UP Public Health Laboratory Measles Requisition Form, which is available at wuphd.org. If the sample is going to the Michigan Bureau of Laboratories, pre-approval is needed from the MDHHS Communicable Disease Epidemiology Division by calling the number on the screen. The state lab also has a testing request form available on their website. Whenever measles testing is contemplated, please contact the local health department, as we would like to be informed and assist you through this process. It is essential that specimens be properly packaged and shipped. PCR specimens need to be transported on ice packs. If shipped, the specimen should be frozen at -20 degrees Celsius and shipped overnight on ice. Serum can be sent frozen and shipped on dry ice. It can be stored frozen for up to 8 weeks. Each sample needs to have 2 unique patient identifiers, such as full name and date of birth, both on the specimen container and on the test requisition form. Include a copy of the paperwork with the sample. Missing information can result in testing delays and possible specimen rejection. This slide shows the address for sending specimens to the Western Upper Peninsula Regional Public Health Laboratory. Note the days the service is available. This slide shows the address for sending specimens to the Michigan Bureau of Laboratories. Again, note the days the service is available. Given dramatic shifts in staffing and changes in the testing available, testing through the CDC is currently limited. It is recommended that samples intended for the CDC be sent to the Michigan State Bureau of Laboratories or the Regional Public Health Laboratory. These laboratories will forward the samples to the CDC. Once we have an outbreak, what's the clinician's role in containing it? First, with the assistance of the health department, identify susceptible contacts. These are individuals lacking 2 doses of the MMR, lacking laboratory confirmation of immunity, or lack a history of disease. Those born before 1957 are considered immune. In providing post-exposure prophylaxis for exposed, susceptible contacts, the preference is to administer an MMR vaccination within 3 days of exposure. Alternatively, you can give the measles immunoglobulin within 6 days of exposure. Immunoglobulin is also preferred for those under 6 months of age, pregnant, or severely immunocompromised. If you suspect a susceptible patient has measles, notify the health department immediately. The patient should be immediately put into isolation and excluded from school, daycare, work, camp, or other group activities. The patient can be released from quarantine after the 4th day of the rash. Susceptible exposed contacts should get the first MMR within 72 hours of exposure. After vaccination, with some exclusions, they can go back to work, back to school, or back to daycare. They need to be monitored for signs and symptoms of measles. The second MMR should be scheduled 28 days after the first dose. Exposed contacts who have 1 MMR and decline a second vaccination do not need to be excluded from group settings, but still need to monitor for symptoms of measles. Those who receive the measles immunoglobulin need to be quarantined for 21 days after their last exposure, with an additional 7 days of monitoring for symptoms. Those who were vaccinated more than 72 hours after exposure need to quarantine for 21 days after the rash onset of the final case in the outbreak setting. If more than 6 days have passed since exposure, it's too late for either the MMR or the measles immunoglobulin. In this situation, the contact needs to quarantine for 21 days after the last exposure. The MMR is 97% effective in those who've had 2 doses and 93% effective in those with 1 dose. If a vaccination contact is healthy, no further action is needed. Because breakthrough infections can occur in the 3% in which the vaccine was not effective, these contacts need to monitor for signs and symptoms. If they get symptoms, these tend to be milder than the typical case of measles. Immunocompromised contacts should alert their clinician, as they may be candidates for the measles immunoglobulin. Nothing ever goes as planned, so we will be distributing current list of where MMR vaccine can be obtained. We will be providing credible information both in print and in video media in real time. The outbreak may stress the ability to confirm a measles diagnosis with laboratory tests. There may be a shortage of testing material, so before collecting specimens, determine which laboratories are able to run the test in a timely fashion. Your local health department can help with this. Any questions?